Hello everyone, this is Professor Yamini Bhushan Tripathi again, and we are interacting for a 12-week certificate course on palliative care with integrative approach. On the last few lectures, we have discussed how to manage the symptoms which appear in patients of palliative care. Because these patients are chronically ill, so at one hand, the mainline treatment is going on, but the effect of the treatment is not very good. The prognosis, we call it in medical term prognosis. The prognosis is poor, and it adds financial burden to the society also, to the family also. So financial burden because of non-productive medical treatment. But at the same time, discomfort of the patient is also there. So our goal of palliative care is to give him comfort. We all know, patient knows, his family knows, the doctor knows that disease is not going to be cured and the patient is not going to survive for a very long time. And whatever treatments the doctors are prescribing, the prognosis is very poor. In that case, what we should do? Very important decision. Suppose a patient is on the ICU and his son will never think of taking the patient away from ICU, from ventilator, because he is afraid of the society. He is afraid of his own conscience. What people will say, okay, look, his son has taken his father out of ICU, out of ventilator, and he died. This kind of social stigma, who will tolerate? Nobody will tolerate. So then, what to do? Legally, patient should be allowed on ventilator as long as he is living. What we call brain death or something, the medical terms are there. But it is very expensive, very painful for the patient and for the family also, for the relatives also. So now the question arises, what the land of law? In Netherlands, self-death is allowed. You can declare that I want to die, choice of death, but it is not in other countries. Very few countries have this kind of. In India, we don't have it. But a Supreme Court decision in 2018 has given some leverage to the patient and his treating physician, in which condition the life support system can be withdrawn. So I think today we are going to talk to bring you awareness about the law and about the conditions when you can start talking in this direction. The topic of the talk is Ayurveda, ethics and end of life care. But here we are going to talk about integrating classical wisdom with modern legal framework. Legal framework, remember. So what Ayurveda says, in Charak Samhita, there is a separate chapter called Arishta Lakshana. Arishta Lakshana means those symptoms which indicate the Vaidya that the patient is not going to survive for a long time. And the symptoms are so specific that Vaidya can predict whether a patient is going to survive for a day, for a week, or for a month, or for some time. I mean, the Ayurvedic knowledge was very, very, I should say, advanced. But it was not developed scientifically. No objectivity was made. And the allopathy doctors and the scientists, they did not join hand with the Ayurvedic scholars. That's why it has been a rudimentary science. Even in USA, Ayurveda is not treated as a medicine. Even traditional Chinese medicine, TCM, is recognized as a healthcare system. But Ayurveda is not recognized. It is recognized as a philosophy. Why? Because we have not done scientific work. Anyway, we will come to this topic later on. But today I am going to talk what Ayurveda says in Arishta Lakshana. So Ayurvedic perspective, on ethical issues in palliative care, end of life care. The ethical aspect of palliative care definition, it improves the quality of life for patient with serious illness. This is the aim. What is the core focus? Comfort of the patient, dignity of the patient, holistic support, and not the cure. Our focus in palliative care is not to cure the disease, but to focus on comfort, dignity, and holistic support. What are the key challenges which a palliative caregiver faces? Navigating complex ethical decision. Ethical decision, how to reach to a decision, that is very challenging, because you have to convince the patient, you have to convince the doctor, you have to convince his family. Look, I am trying my best to give the comfort which he should get. I am trying my best to maintain the dignity of the patient, his belief of the patient. But these are the ethical issues which you have to decide. And objective, raise awareness about ethical principles. How you can convince? By bringing awareness about the ethical issues. So key ethical principles, what? Autonomy. Patients have the right to make their own healthcare choices. This is the, as per law, land of law of land, India. Patients have the right to make their own healthcare choice. Whether you want to go on ventilator, whether you want to go for intubation, whether you want to go for IV, for surgical intervention, you have to decide. You have a right. The providers must offer clear, honest, and information. I mean, the provider, healthcare provider, should inform them. These are the pros and cons, what you are choosing, and these are the pros and cons, what other alternatives are there. Very honestly, without any giving false hope, he should tell the truth. How to tell? This is also an art. You cannot say that, look, you are going to die tomorrow. You cannot say like this. The method of communication is very important. Secondly, the beneficence and non-maleficence. Maximize benefit, minimize harm. Maximize the benefit and minimize the harm. How? Emphasize pain relief. Pain is the most important factor this kind of patient faces. So pain management comes in the first. Emotional and spiritual support. Give the patient emotional support and give the patient spiritual connection. Because every religion says that we have governed by the Almighty. Names are different, methods are different, terminologies are different, but the theme is the same. Every individual in every religion is being linked to the superpower, whatever name you give. So justice, fair access to palliative services for all. I mean, palliative services are not available to all because of the financial constraint, because of the unawareness, because of the unavailability of the people. But somehow, we should try to give access to all people of your country, of the world. Address inequality in resource allocation. This issue is policy matter. Government has to decide. Insurance companies have to decide. Resource allocation for palliative care to every needy person, whether he is a rich or poor, that is a policy matter. And health is a state responsibility. Government should take care of it. They should make the policy. This is it is lacking all over the world. In India also it is lacking. So decision-making consent, informed consent. Patient must understand their prognosis and options. Prognosis means whether the disease is being cured by the existing line of treatment or not. Prognosis, this is a medical term. And options, what are the other options? He should know very clearly and understand. If a man is from a village background, you cannot talk to him in English, you cannot talk to him in Khadi Bhasa, you have to talk to his local language. So, basic idea is to make him understood the pros and cons of the treatment. This is the responsibility of a caregiver, palliative caregiver. The course which you are doing, you should know what is the language, what is the method. Suppose he is a very ill patient, he is not able to listen, then you have to make some signs, some picture, which he can understand. Anyway, you have to get understand. Shared decision making, collaboration between patient, family, and healthcare provider and palliative care provider. This is very important. Shared decision making. Advance directives, plan care in case of lost capacity to decide. Suppose the patient has lost the capacity to decide about his future, about his death, about his life, then plan care, how it should be managed so that patient's dignity should not be compromised. Patient's desire should not be compromised. Ethical challenge. What is the patient? What if the patient is non-communicative? He is unconscious. He is on ventilator. He is not able to talk. He is not able to see anybody. What you are going to do in that case? This is ethical challenge. The government of India has made some rule, okay, how this can be challenged. End of the life issues and cultural sensitivity. There's what I talked in the beginning. Cultural sensitivity. What society will think about your decision. Focus on a dignified natural death. What is dignified natural death? You have to understand it. Euthanasia and assisted suicide, legal and ethical debates. Euthanasia means you are killing somebody. If you are taking away the ventilators or the life support system, you are considered as you are doing euthanasia. It is like an assisted suicide. You are allowing the person to die. Suicide means somebody kills himself. You are assisting him to do it. This is the two different issues. You have to make a very clear line of differentiation, and you have to act accordingly. Cultural ethics, tradition influence care preferences. What are the traditions in the family, in the society? They are influencing the preferences, care preferences. Importance of cultural competence in healthcare. Cultural competence in healthcare team. How to do it? The role of communication and compassion. Communication, be honest and compassionate. Be honest. You cannot give a false hope, but compassionate, very carefully, very mildly you have to communicate. Help patient and families cope with fear of uncertainty. You know that patient is going to die. Everybody is afraid of what will happen next moment. You have to give confidence with compassion, whole environment, and emotional support. Build trust. Reassure without giving false hope. That's what I am telling time and again. No false hope. No false hope. Build a trust. Reassure everything without false hope. Conclusion. Ethical palliative care is about respect, dignity and compassion. Bas. That is the take-home message. And a more human system starts with ethical awareness. More human system. You are a man. You are talking to a man, not a robot. This kind of feeling should be there. What is Ayurvedic palliative care now? Core principles. Compassionate care, dignity and holistic well-being in terminal stage. Ethical focus, balance, truthfulness and acceptance of mortality. Ethical focus what? Balance, truthfulness and acceptance of mortality. Classical wisdom, clinical ethics and legal clarity are a guidance document for practitioner, researcher and policymaker in this field. What is important? Classical wisdom, clinical ethics and legal clarity. These three things you should know. So Ayurveda offers holistic and ethical guidance for end-of-life decision. Classical text emphasizes truthfulness, non-violence and appropriate care. Truthfulness, non-violence. Not non-violence means not only physical. Even medical and mental violence is also not allowed. Key ethical guidance and Ayurvedic texts in palliative care. Here I mentioned you some Charak Samhita, Shushruta Samhita, Ashtang Hridaya means Vagbhat, Kashyap Samhita, and Bhav Prakash. There are 5 textbooks I have mentioned here. What they are the ethical principles of Vaidya Dharma. Vaidya means a Ayurvedic physician. Physician's duties in palliative care. There are 3 important duties these text has defined. Avoid unnecessary suffering. Ahimsa. Ahimsa means no hinsa. Hinsa means you are killing somebody. Not killing, you are torturing somebody is also hinsa. Mentally you are torturing, this is also hinsa. So ahimsa, avoid unnecessary suffering. Satya, speak truth, truthful communication, no false hope. These are the duties of a Vaidya who is treating the patient as per Charak Shushruta Vagbhat. And Sadvrit, ethical behavior in patient care. You should ethically behave. You are not exploiting a patient, their family. Ethical is very important. There are 4 Purusharth, Dharma, Arth, Kam, Moksha. Dharma come first. That is ethics. Then you can earn the money by ethical manner. Doing anything unethical is not accepted in any culture. The Dharma, Arth, Kam, Moksha. Here also the Maharshi Charak has said, patient, Vaidya should be ahimsa, he should be truthful, he should be ethical. 3 things. Now you see, Vaidya Dharma, neither harsh nor lenient. Charak Sutra Sthan 925. Dying with dignity. Avoid prolonging suffering. If a patient is dying, Aris Lakshan has appeared, prolong suffering. Avoid it. Don't allow patient to tell the truth with these 3 things. Chikitsa, Vigyan. This is the shloka. Shushruta what says? Truthful communication in terminal care. This is the Shushruta Sutra Asthan 3.34. Herbal and psychological pain management. Pain management should be medicine, herbal, and psychological. Both. Shushruta says. What Vagbhat says, avoid aggressive intervention. Ashtang Hridaya Sutra 1.5. Avoid aggressive intervention. Sattva Vajaya Chikitsa for mental preparation. Sattva Vajaya means psychological counseling. You have to do. You have to prepare the patient and family that now your time has come, you are going to die, you are going to depart from your family by psychological counseling. Kashyap Samhita what says? Geriatric care, Jara Chikitsa. Family involvement and spiritual practices. Call the spiritual gurus, let them interact with the family and the patient. So this is the Kashyap Samhita says. And geriatric care means rasayan. All the physiological weaknesses the patient is having, if it can be improved by giving rasayan, ahar, nidra and brahmacharya, there are 3 pillars. All the 3 things you will apply, and if his quality is improved, you have achieved the goal of the patient. And what Bhav Prakash says, practical tips, pain relief, sleep and diet, the same thing which I told you. Natural death over aggressive treatment. This is the summary of all important texts of Ayurveda. All are saying what is the guideline. Arishta Lakshana, I told you, this is chapter in Charak Samhita, signs of imminent death, physiological, psychological and spiritual signs. What Charak say? Charak Indriya Sthan, Sutra and Sharira Sthan, Sutra Sthan and Sharira Sthan. This is reference. Loss of consciousness, shadow or reflection, irregular breathing, sudden euphorbia before death, season of hunger and thirst. No hunger, no thirst. This is lost. Unnatural vision, sounds. I mean, you start dreaming something unnatural. Some sound starts coming, humming sounds in your ear. Nothing is there, but patient start feeling like that. He lost hunger. He lost thirst. He is not eating. He left eating. And euphorbia before death, fear. And this can cause shadow reflection, irregular breathing. Breathing pattern will be changed. These are the important signs which indicates the patient is going to die. From Shushruta, cold body becomes cold. Skin discoloration, color of the skin changes. And hallucination, false dream. Ayurvedic principle in pediatric care, truthful communication, no false hope, herbal pain relief like ashwagandha, jatamansi. They are working on the mental level. They are not the like a non-steroidal anti-inflammatory drug. They are working on your brain, the what you call endorphin receptors. They are managing from that level the pain. Spiritual and emotional support, mantras and meditation, these things the patient should start doing or listening, and natural death over unnecessary intervention. This is the principle of Ayurveda. Legal framework in India now. Up to now, I have discussed about what Ayurveda says. Before that, I discussed what is the principle of palliative care. Now, I am discussing legal aspect, what Government of India law says. Key requirement, legal plus medical consensus. Right to die with dignity. The Supreme Court decision 2018. Passive euthanasia permitted for PVS terminal cases. The Supreme Court has allowed right to die. But how? Legal and medical consensus should be there. There is a very stringent rule, medical guideline, and there is a very clear law. So a lawyer and a doctor should sit together and make a plan, discuss thoroughly the patient's situation and the act. Then only you can take a decision. The Supreme Court has allowed you, but with a lot of caution and precaution. Key laws, Article 21 of the Constitution. Right to protect dignity in life and death. Dignity in life and dignity in death, in both, Article 21 says. When you are dying, you should die in a dignified way. If you are living, you should live dignified life. Very important. IPC 299 and 304. Culpable homicide risk if not legally followed. If it is not legally followed, the legal and medical not properly followed, it will be considered as a homicide risk. You can be jailed. This is attempt to murder. 304 is attempt to murder, homicide. And ICP 306 and 309, active euthanasia is illegal. 309 means murder. 306 is attempt to murder. So, you are not carefully following this, you may be penalized by the government rule very carefully. That's why people don't take the risk. Who will take the risk? Who is going to take this kind of thing? That's why the very stringent laws are there. And the patient, if it is conscious, then it is easy. If he is unconscious, then it is more difficult. The ethical implication in Arish Lakshan, recognizing futility in treatment. Futile matlab, treatment has a futile effort. No positive response is coming. Unnecessary you are giving medicine, you are touching the patient, you are financially burdening the family. Prepare the family and patient spiritually. Tell them, you look, Atma and Paramatma are the same. Advaitvad what says? Atma is a part of the Paramatma. Advaitvad says, we are come from Atma, Paramatma, God. So this type of spiritual teaching should be initiated in family. Supporting withdrawal of unnecessary intervention. Withdraw the unnecessary intervention. And promoting peaceful natural death. This is the main objective. What to do and what not to do. Integrative Ayurvedic lecture. Use a prognostic tool. Document observation. Make a document. Observational documentation. Collaborate with ICU team and legal expert. What I told in the previous slide. A doctor and an advocate. Both should come together. Do not. Never sole criteria for life support withdrawal. Never sole criteria for life support withdrawal. Avoid conflicting with active euthanasia. This is a very important issue. Euthanasia, active euthanasia means homicide, the same thing. Legally, you are involved. So, Ayurvedic application in legal context, use Arist Lakshana, what Charak Sushruta Vagbhat has said. Follow that. How to follow? Make a document. Proper documentation of the symptoms, either by Ayurvedic method or by allopathic method. It should be properly documented, because the government wants proof. That document will tell you. Look, that's why the legal person or the physician or the family, they will allow to take decision. Prognosis, supporting palliative care and family counseling. Precautions must combine with modern diagnosis. I am not saying that only Arist Lakshan based on these symptoms you should take decision. It must combine with modern diagnosis, because this is the legally accepted norm. Ayurveda is not legally accepted, but this is legally accepted norm. So you have to follow this and follow this also. Document clearly. Involve legal and clinical expertise. Best practices for Ayurveda: holistic care. Combine herbs, dashmul, diet like khichdi, oil like Brahmi oil, family counseling, explain Arist Lakshans, role and legal protocols, legal complications, secure written consent for judicial approval. Ayurvedic palliative recommendations: Rasayan Chikitsa for the whole body, mind body, quality of life improvement. Herb like Dashmul, Ashwagandha, Jatamansi, they are the mental and physical, taking care. Mental therapies, mantras, meditation, family support. Supportive diets like khichdi, soups, herbal. This is the recommendation because the digestive power of the patient in old age has declined. So only he should be given nourishing diet which is palatable to him, which he can digest, then only he will be healthy. If you are giving some very good food but he is not able to digest, what is the meaning of it? That's why they have recommended. Oil therapy, Brahmi oil, Mahanarayana oil, because the pain is always there in the old age. So these oils help in maintaining the pain. A practical bedside tool to decide by the practitioners about palliative care. Arist Lakshan signs, legal protocol, living will, judicial approval, palliative care initiation points, when to start palliative care, and communication strategy with the family. This is the practical method how to do it. Now, coordination between Ayurvedic and modern medical team to decide the ethical withdrawal of it. Now, I am taking you the integrative approach. First, I talk about social aspect, cultural aspect, Ayurvedic aspect, modern aspect, and legal aspect. Now, I am talking about how integrate Ayurveda and modern. Interdisciplinary collaboration model include examples or suggested model of Ayurvedic and allopathic co-managed terminal care. They have a protocol. Allopathy is a protocol of terminal care. Follow that. And Ayurveda, I have told you. Spiritual counselors and family therapists as part of the care team. Hospital committees for end-of-life care that includes Vaidya, bioethicists, and legal advisor. Ethical dilemma and resolution. How to resolve the ethical dilemma, that is very important. Ethical dilemma means continuing tube feeding in an unconscious elderly patient and corresponding Ayurvedic and legal perspective. There is ethical. Suppose there is the intubation, a food is being given by his nose, by tube, by injection. Should we continue or not? If you don't continue, the patient will die. And if you continue, you are torturing. That's why the ethical dilemma is there. So when an Ayurvedic physician uses Arist Lakshan sign to suggest a shift to palliative care, how families respond when a spiritual care, mantra therapy and Rasayan Chikitsa are initiated. Because most of the family will not believe it. They say, no, I want the modern medicine, I want the ventilator till he is alive. But you have to convince him, look, prognosis is not good and now you should switch on to spiritual therapy, mantra therapy, puja part and Rasayan Chikitsa. If they are convinced, then things will move. If they are not convinced, go to the modern medicine, let the thing go, but don't take the risk, never. Categories of pain and their management. Now, since I have told you the pain is the main issue in the old age, so what type of pains are there? This is the paracetamol, non-steroidal anti-inflammatory drug, opiates, is a nociceptive neuropathic pain. This is the nociceptive pain. This is the neuropathic pain. In this case, these medicines like pregabalin, these things are bone pain. This is another thing. Bisphosphonate, radiotherapy are recommended, and breakthrough pain, rapid-acting opiates like fentanyl. So these are the group of medicines, modern therapies, and these are the type of pain the doctor will diagnose. As a palliative care giver, you have to connect your patient with the medical team. Depending on this kind of pain, they will decide what drug has to be given. You cannot do anything. You are just to connect your patient with the doctor. Community use modern formulations. Anticonvulsant, gabapentin, pregabalin, antidepressant, opiates, and ketamine. So these are the group of medicines, and these are the lidocaine patches, corticosteroids, paracetamol, and NSAID. Okay? Now, special consideration. Step 1, mild pain, moderate pain, and severe pain. So in mild pain, paracetamol and non-steroidal anti-inflammatory drugs like brufen are recommended. Moderate pain, weak opiates, tramadol, codeine, these adjuvants are recommended. Severe pain, a strong opiate, morphine and fentanyl are recommended. WHO analgesic ladder. WHO has defined a ladder at which stage what medicine should be given. What is ladder? Individualized dosing, multimodal approach, monitor side effect, constipation, sedation, tolerance, and adjuvant therapy like physiotherapy, counseling, and complementary medicine. Here you see, I have given you, in the case of moderate pain and severe pain, these medicines plus adjuvant therapy. This is adjuvant therapy. Do physiotherapy and this medicine. Do counseling and this medicine. Do use complementary medicine like the Smooth wrist, the Smooth Quath, Ashwagandha, all these things. So this is a table I want to show you. Palliative care in context of pain management. Physical therapies, psychological support, spiritual care, complementary therapies, occupational therapy, music and art therapy, breathing and relaxation like pranayama, and social support. So there are A1, 2, 3, 4, 5, 6, 7, 8. There are 8 approaches to manage the pain. Techniques are given here, heat and cold therapy, massage, exercises. Psychological means cognitive behavioral therapy, CBT, counseling, guided imagery. Spiritual means mindfulness, meaning spiritual gurus can talk with. Complementary means acupuncture, aromatherapy, reflexo. Occupational therapy means adapt daily task, assistive devices. Music and art, listening, creating, engaging with music and art. Breathing, deep breathing, progressive, muscle relaxation, and social support. Family presence, support group, palliative. Your family members, your relatives, your neighbors, they should keep on meeting you to make you happy. Purpose, what is the purpose? Relevance, muscle tension, relieves muscle tension, improves circulation, reduces anxiety and improves coping. Psychology. Spiritual care, inner peace, emotional well-being. Complementary therapy, relaxation and mood elevation. Occupational therapy, reduces discomfort during activities. Music and art therapy, emotional expression and distraction. Breathing and relaxation reduces stress and physical tension. And social support reduces sense of isolation and improve mood. Now, Ayurvedic formulations for pain relief. Dashmul Quath, Ashwagandha plus Bala, Jatamansi plus Brahmi Ghrit, they are the internal use as a medicine. External use, Mahanarayana Tel, Dharmantri Tel, Chir Bala Tel, they are for external use. Precautions, Contraindicated in acute fever or bleeding disorder. Suppose a patient is having bed sore, you cannot do massage and all. So you have to be careful, precaution. Customize formulations based on Prakriti. There are three Prakriti, Vata, Pitta and Kapha. Mental, Sattva, and Tam. You have to decide like that. Consult Ayurvedic physician for doses. Without physician, don't take any decision. So now the key allopathy medicines for pain management: opiates, NSAID, adjuvants, steroid, local anesthetics and others. Moderate to severe, I have told you the classes of the pain: bone pain and inflammation, NSAID, adjuvants like neuropathic pain, steroids for the pain from inflammation or edema. Local anesthesia is a localized nerve pain. They can block the nerves. Others means mild pain, NMDA receptor pain. These are the things. These are the method of giving. Some are oral, some are intravenous, or transmembrane patches, different. And these are the name of the medicines which you should know, but you cannot apply it. A doctor will do it. Now I am coming to the non-pharmacological method of pain. I mean, up to now I have discussed what are the medicines should be given, what are the physical or mental balancing oriented medication. Now I am talking non-pharmacological, no medicine. How to do it? Non-drug approaches are crucial in holistic pain management. Support physical, emotional and spiritual well-being. Useful when pharmacological methods are inadequate or causes side effects. If you are giving a non-steroidal anti-inflammatory drug, there is a chance of gastritis. The pain is not going away, but at the same time the patient is having gastritis. This is no good. So in that situation, you should do non-pharmacological method. Physical therapy, physiotherapy, massage therapy, heat and cold therapy, and TENS, electrical nerve stimulation, blocks the pain signals. So these are the methods which can be applied. Now, modality: radiotherapy, interventional pain technique, surgical method, physiotherapy, TENS by electrical, and palliative care input. Radiotherapy for localized bone pain and spinal metastasis. Interventional pain technique means nerve block the nerve, which is making you feel pain. And these are the nerve. Surgical method means for pathological fractures, spinal cord compression. I have already discussed spinal cord compression, right? Physiotherapy means help maintain function and reduce stiffness. And TENS, transcutaneous external nerve stimulation. Palliative care, individualized care plan for chronic and terminal. Now, one by one, psychological intervention, CBT is most important. Cognitive behavior therapy modifies pain perception. Pain is there, but perception has changed. Now you are tolerating because of the opioid receptors. Endorphin have been being secreted because of psychological. Mindfulness and meditation reduces anxiety and enhances coping with the problem. Relaxation technique, guided imagery and deep breathing and supportive counseling helps with emotional distress. This is the psychological intervention. This is the complementary therapy, acupuncture, aromatherapy, music therapy, and yoga therapy. Now, social support, this is also very important. Spiritual care fosters peace, reduces existential distress. Family and peer support enhances emotional resilience. Recreational therapy boosts overall well-being. Recreation. How recreation will be given? Depending on the likeness of the patient, likeness and decline. And environment modification, soothing surrounding family objects. Integration palliative care means use a multidisciplinary team approach. Who are there? Doctor, nurse, spiritual guru, yoga teacher, everybody is in your team. Tailor therapies to individual preference and needs. Evaluate outcome regularly. I mean, if you have made a team, see whether its outcome is positive or not. If not, change the team. combined with pharmacological treatment when necessary. You are doing a non-pharmacological, but if required, take some medicine also. Psychological tools for pain management, I have told you CBT is the most important. Psychological tools play a key role and help address emotional, cognitive behavior, improve quality of life. So identify and change negative thoughts patterns. See, what is CBT? In this, the psychologist identifies thoughts and change negative thoughts pattern, encourages adaptive coping strategies, enhances sense of control over pain, useful in chronic and cancer-related pain. So CBT is a technology given by psychologists. So what are the approaches in here? Psychology, CBT, I have told you, mindfulness and meditation, relaxation techniques, acceptance and commitment therapy, ACT. What is this? Value-based action, acceptance of suffering, improve psychological pain. Supportive counseling, active listening, validation, and emotional support. This is also very important. This you can do as a palliative caregiver. For these things, a psychologist is required, but this you can do. Active listening, validation, and emotional support. Build trust, reduces emotional distress, and dignity therapy, dignity, life reflection, legacy building. This is also by better communication you can do it. Enhances meaning of life, reduces existential distress, and behavioral action, encouraging pleasant activities, counters withdrawal or boost mood, and psychoeducation, teaching pain coping strategies, empowering patient and caregiver. Now, psychological tools. What are the psychological tools? These are the some technical name. Substances used to risk assessment. This is the SOAPP, screening for opioid misuse in chronic patient. Counseling and goal setting aligns pain management with patient goals. CBT, I have told you, managing fear, anxiety, depression related to chronic pain. Patient education on safe opioid use, how to use opioid, when to use, how much to use, everything you have to educate him. Managing expectations and adherence check and follow-up, urine testing, pills counting, caregiver reporting for compliance. These are the psychological tools and approaches. Now, mindfulness-based intervention, mindfulness-based stress reduction, MBSR, focuses on awareness of present moment, reduces emotional distress, and improves pain tolerance. It enhances emotional regulation and calmness. Guided imagery and relaxation technique. Visualization of peaceful senses to divert attention from pain. Progressive musical relaxation to reduce physical tension. Breathing exercises to promote calmness, often used alongside other therapies. What is this? Guided imagery relaxation technique. Now, support psychological psychotherapy. What it does? It builds emotional support and therapeutic alliance, allows expression of fear, grief, and spiritual distress. It promotes acceptance and dignity in end-of-life care. And it also involves individual, group, and family therapy. And behavioral action and coping skills encourages engagement in pleasurable and meaningful activities. It reinforces positive behavior to reduce avoidance. It teaches problem solving and pain coping strategies. And it improves sense of purpose or motivation. So legal cases, now I am just giving you an example. Legal cases studied and consent template. A common cause versus Union of India. This is a legal decision. Issue, passive euthanasia, legality. Ruling, withdrawal of life support permitted for PVS, patient via advance directive. If the patient has given a directive in his conscious mind, then you can withdraw it. This was the decision, Supreme Court decision. Ayurvedic relevance, Arish Lakshan can supplement prognosis but needs modern medical validation. Case number 2, Arun Shanbag case 2011. Withholding nutrition for PVS patient. Outcome, court allowed withdrawal only after medical record confirmation or irreversibility. I have told you in the beginning, documentation is very important. So take home message is the consent template outlined based on the legal reference, Indian Penal Code, section 299-304, medical treatment and terminally ill patient bill. This is pending, this is not approved. Patient details, name, diagnosis and prognosis. Prognosis confirmation, modern medical report plus Arish Lakshan observation of Ayurveda. Family consent. We understand the irreversible condition and agree to withdraw life support. Legally, in written, the family should give the consent. A legal witness. Signature of 2 independent witnesses. What for? For all these above points. Witness should be there. Then physician and hospital affirmation. Physician and hospital. Both are important. Summary. Ayurveda promotes dignity, compassion and balance in end of life. Arish Lakshan helps guided ethical decision. Modern legal framework must be followed for safe application. Holistic care includes body, mind and soul, and collaboration between traditional and modern system is the key. With this, I end my talk, and in the end, I am putting you a case for discussion to write in your Google Classroom. I am just reading it. Patient profile, name Mr. So-and-so, age 78, diagnosed as stage 4 pancreatic cancer with liver metastasis. This is the condition. Prognosis, less than 1 month, confirmed by the modern investigation. He is not going to survive more than 1 month. Symptom, severe pain, loss of appetite, breathlessness, weakness, spiritual distress, and mental status. Conscious, oriented, but often fatigued. Family, 2 sons, 1 abroad, wife at home, emotionally attached, but struggling to accept prognosis. Hospital doctor dilemma. Family wants aggressive intervention. His wife wants, 2 sons are there. Family intervention, including ICU admission and feeding tube, despite the oncologist's advice that the condition is irreversible. He is not going to survive. Oncologist is saying no use, but still the hospital and doctor's dilemma is there. The physician observes unnatural body odor. This is a symptom. Disappearance of shadow, dry, cracked tongue and eyes, declining speech, sudden euphoria followed by deep fatigue. This is the situation of the patient. Now, question is this. Ethical question. Suggested Ayurvedic care. Should the physician insist on stopping active intervention and suggest palliative care only? Can Arish Lakshan be presented to the family as a legitimate Ayurvedic basis for not pursuing further treatment? What Ayurvedic approaches, e.g., Sattva-Vajja Chikitsa, Rasayan herb, oil therapies, could support the patient quality of life? How can the legal ruling on passive euthanasia be used here to document the shift from curative to palliative care? Curative means disease treatment. Palliative means quality of life treatment. Should a living will have been encouraged earlier? How could it help? Suggested pain relief, sleep support, diet, emotional care, and withdrawal of non-food. This is the question. I have given you a natural scene of a patient, and I have put some questions for you. You have to discuss it from your own knowledge, what I have taught today, what you know from other sources, and then you have to answer these questions and put in the book. Thank you very much.